Dobroveče svima, hvala vam na strpljenju. Uspela sam da uspostavim kontakt sa doktorom Robertom Melillom, dakle velika mi je čast što ćemo večeras, nadam se, uspjeti da održimo live. Ceo live će biti na engleskom jeziku, kasnije ćete ceo video moći da propratite na YouTube-u sa prevodom. Hvala vam još jednom, sad ću se prebaciti na engleski jezik. It's a great honor to have live with the famous Dr. Robert Melillo, who is a neurologist American and also the author of many books for children that have disabilities. Now I will send invitation to the doctor, so let's hope everything will. Doctor, I'm trying to.
Okay, hi.
Yay, we did it.
We did it, yes.
Yes,
fantastic.
Thank you so much. I don't know why, but our app is working very badly. So hope that everything will go nicely tonight. Yes. For us, but noon for you. Yes. Thank you very much for the opportunity to share this great information about you, your work, your books, and for sharing great information to parents who are seeking for the solution for a quality life or for their children.
Yes, yes. Great. You can hear me okay?
Yes, yeah, yes. Good. Well done. I hope.
I'm excited to be here.
Thank you so much. So it's an honor. And I told my followers that you are a famous neurologist and author of many books, which are very helpful in our journey through autism. So can you, for the parents who are less familiar with your work, tell to parents what is your mainly work and how do you work with our children? How do you work with parents? What is the area you work with? Because neurology is a great deal to say, but I assume you work in specific neurological area.
Yes. Yeah, I work in an area really called functional neurology. It's very different from traditional neurology. Traditional neurology deals with organic neurological illnesses, you know, tumors, strokes, brain injury. And although we deal with some of that, the fact is, you know, we're working with all different types of issues that are not related to clear organic illnesses. There's no brain injury, there's no pathology, there's no genetic mutation, there's no metabolic disorder per se, but yet, you know, there is clearly severe neurological symptoms, as in things like autism spectrum, especially non-speaking autism spectrum, which is really one of my primary areas of specialty in practice and in research. But we work with a number of different what's called neurobehavioral issues like ADHD, OCD, Tourette's, tics, and not just in children. We look at developmental functional neurology, which really looks at anything that's developmental. And when we look at most adult mental health issues, whether it's bipolar, schizophrenia, depression, anxiety, most of them we now know really start in childhood. They may manifest later on in life, but if we go back, we see that the roots start in childhood. So my approach, which is unique and different, is basically, you know, when most people come to me from around the world and they have a child, let's say, that's not speaking and has autism, I ask them, has anybody ever tried to explain to you what's actually happening in their brain? Yeah. And they look at me and they say, no, never. And so I tell them that's what's unique about what I do. What I do is I've spent 30 years researching what is actually happening in the brain. And we're still publishing. We just had a paper accepted last week in one of the top journals in the world on the neuroanatomy of autism. So, you know, we have about 4 or 5 other papers coming out just over the rest of this year on a study that we've been doing, a randomized double-blind control study looking at autism and something known as primitive reflexes. So my focus is what is actually happening in the brain and what can we do to change that? And not just manage symptoms and behaviors, which is what most other treatments really do. They don't really deal with the core issue. And the fact that they don't even talk about what the core issue is because they usually don't really know what that is. And they're just trying to manage different individual symptoms, like diet and nutrition, which is important. And I know a lot about that. I also, have degrees in functional medicine and neuroimmunology, but that is not usually, that doesn't cause something like autism, and that's not the solution to, autism at all. The idea is trying to actually change the brain.
Yes, there are many speculations in our country. Some of the scientists say that it's genetically, some say it's not. Some say it's connected to the vaccines, some say it's not. Some say it's mainly connected to the way the pregnancy went. If something went bad, like a bacteria or anything that disrupts normal pregnancy period, it also can be connected to autism. And also there is lately an information that if someone is trying to get pregnant and goes through that all circles, what it needs to all kinds of therapy to get pregnant, it also may cause the autism in child. So there are so many answers, and we are just trying to float in that ocean of information. And it will be greatly helpful if you can say to us what is your research say, what is causing the autism. And because many of parents are confused because there are children that are nonverbal, but also there are children who were verbal in the early childhood, but after at the age of 2 or 3 they stopped talking and they got diagnosed with autism. So it's very confusing that you have a child that has normal development and suddenly it stops. So can you tell us, please, what is your research institute? How do you deal with that sort of information, and what do you think causes autism?
Yeah, my third book is called Autism, the Scientific Truth, is where the whole book is exploring this question. It's impossible to talk about cause, but what we can do is talk about what elevates the risk of having a child with autism, right?
Yes.
And so one of the things for sure is that it's not genetic. It's not a genetic mutation. There are 10% of kids with autism that are called syndromic autism that have a genetic mutation like Down syndrome or Fragile X, tuberous sclerosis, and are also diagnosed with autism. They have autism features, but it's not autism, not what we really look at. The vast majority don't have genetic mutations. There is no injury to the brain. There's no damage. There's no pathology. There's no metabolic issue. When you look at the brain grossly, it looks perfectly normal. And this is why it's so mysterious, right? Now, in our research, we've been able to show that there are different things that affect the growth of the brain or maturation of the brain. And the primary problem is what's known as a functional disconnection, especially between the two hemispheres of the brain, where there's an underdevelopment of the right and immaturity, and there's an overdevelopment of the left. And all of the symptoms of autism can be explained by overactivity of certain areas on the left hemisphere and underdevelopment of the right. So things like tics or stims or obsessive behavior or, you know, an overactive immune system or anger outbursts or laughing for no reason.
Yes.
These are all things that are caused by specific areas of the left hemisphere. The underdevelopment of attachment and the drive to attach, the fact that they don't really become very connected to their body, that they don't feel their body very much, and they may have a really high pain threshold, and, you know, or have underdevelopment of certain different emotions that are right brain, like fear or sadness or embarrassment and shame and guilt, along with things like attachment and empathy. These are right brain emotions and functions that don't really arise. Now, you know, what leads to this? Most of what we believe is environmental factors that are lifestyle driven. There are certain things in our lifestyle today that elevate the risk of having a child with autism, but they are superimposed on traits. So there are genetic traits, and there's traits that we know that people that are highly intelligent, that have very strong left brain dominant traits, people that work in technology, that work in the IT industry, anywhere in the world there's a cluster of people that work in IT, there's a dramatic increase in autism in those communities, like in Silicon Valley. Yeah. You know, we know that the families of kids with autism, they have a much higher incidence of other people in the family that are good in mathematics, that are professors, that are in physics, that are engineers. Yeah. The most common occupation of a dad of a kid with autism is an engineer. Why? Because they have very good left brain skills. This is an intellect trait. It's not a mutation, it's a natural trait. But if you get two parents that come together, that child may have an overdeveloped left hemisphere. And then we live in a society that doesn't really build the right hemisphere very much anymore. We're so technology driven. We have less interpersonal communication, less movement at earlier and earlier ages, less interaction with nature. There's so many different factors that affect it. So there are, most of what we believe, like in autism, it really starts, you know, in the womb with different, you know, what we call epigenetic factors. Autism is not caused by vaccines. It might be exacerbated by vaccines, but it is not caused by vaccines. Otherwise, every child that's ever been vaccinated would have autism, and they don't. What we see is that regression that occurs around 2, what we see is that we see that in children that have been vaccinated and not vaccinated. And most of those children didn't have totally 100% normal development up to that point. They usually are delayed in certain milestones. They are delayed in many of their motor milestones, skip crawling, or they're delayed in speech, or they have very poor nonverbal communication. So there's other issues. They may have overactive immune system and get eczema early on. So there's different things, if you know what to look for, that are already there, usually from the first few months. But at 2, what we see is there's a huge growth spurt that occurs in the brain. It's probably the largest in our brain in our life. And when there is an imbalance in development, what we see is that the right brain should be developing in the first 3 years. If something holds that back, like what we call retained primitive reflexes, then what can happen is in children that are unusually gifted with the left side of the brain, it can come online too early. And so we see some kids like reading below the age of 2, or have unbelievable skills that, you know, memory skills, or really good, you know, with numbers, or they're already somewhat obsessive or have tics or stims. And then what happens is at 2, when there is this really big growth spurt, that imbalance becomes more. And as this imbalance becomes more, you know, the child becomes disconnected more, and they lose a lot of the skills they may already gained. And that may happen a couple of times through development, but around 2 is the most common. Also around 3, it may happen as well. But again, this has to do with differences in maturational development, and that is really the problem. There's a difference. What we see and what we've documented in our research is that there's a maturational delay in the brain. There's more of a maturational delay in the right side, and the left hemisphere, what we see is there's an increase in what we call short range connections, and there's a reduction of long range connections, which again is a byproduct of maturational delays, not damage or injury or genetics.
Yes. So that was so amazing. So tell me, please, there are verbal and non-verbal kids. Why it happens? Why does it happen to a child that it stays non-verbal?
Yes.
Why are some children becoming verbal and some not?
Yes. There's two reasons why a child with autism doesn't speak. One is their left hemisphere is better than most, so they should be able to speak. And actually, even many kids that are non-speaking, when they are taught in ways of communicating, like there's one technique, which is typing on a letterboard or using different, electronic devices. What we often see is that they know everything, right? They're speaking they type in full sentences. So it's not a lack of left hemisphere language ability. There's two problems. One is the drive to communicate to another human comes from the right brain. So initially, eye contact, nonverbal communication, attachment. This is the biggest piece that's missing in autism, is this drive to attach to other people. Children with autism quite often, to varying degrees, they may not really attach to their parents completely. They don't really respond if the parent leaves the room or comes out of the room, or they don't have that, anxiety. But also, they don't have that drive to attach to other children. They don't go up to other kids, or, they might have that drive, but they don't know how to do it. So there's varying degrees of this. Some kids, may want to attach, but they don't know how to do that nonverbal communication piece. Other kids are completely missing it. And they just want to sit by themselves with technology and look at a phone and don't have any interest in other people or other kids. Again, all of this is driven by a right brain delay. The other reason why they may not speak is because the ability to speak, is the most complex motor act that's ever been achieved on this planet by any animal, right? So standing upright is number 2. Speaking is number 1. It's very complicated. It requires tremendous coordination of multiple small muscles in a sequence, as well as breath control, including the lips and the tongue and the mouth. Many of these children are very disconnected from their bodies, right? I just had a child that was just here, 3 years old. They have literally no pain reaction. Like if they fall down and smash their head, they don't react. They don't feel hunger. They don't feel thirst. They may not feel differences in temperature. Basic senses are not really there. It's like they're basically numb to their body. They don't really feel their body. And there's other reasons for this as well. But if you don't feel your body, it's virtually impossible to control a lot of your body movements. So many kids with autism have no control over their own body. They're just spinning all the time, running around, jumping up and down, making noises, flapping. And even if they may have some control, most of the time they don't really have control over their body. And they don't have control over the muscles of speech. So they can't really speak because they can't coordinate the muscles. But the language center is fully developed. It's there. Most of the time, they know everything, even if they don't seem like they know anything. They're all geniuses. Every kid I've ever seen with autism is literally a genius with their left brain. And their left brain is incredibly strong, but they have this severe delay on their right side. So the reason why they don't speak is, one, they don't have they may not have that drive, that nonverbal drive to attach to others and read nonverbal communication, eye contact, facial expression to speak. And then they may not have the control over their muscles of speech, which is called speech apraxia, but it's not because they can't control it, it's because they can't feel their body. And I believe those are the two reasons why a child with autism doesn't speak.
So you said something about the way to communicate, like using technology. How good is for a child to give him that technology, no matter it's verbal or non-verbal? How does technology influences on their brains because they have autism?
You know, our goal is always to get the child to speak. And most of the time, we're successful at that. But what we found is that because all their language is there, if we can actually give them some way of communicating and some way of expressing their needs to the parents, it lowers a lot of their frustration and anger and maybe aggression. And also, it opens the parent to realizing how much they actually know. You know, if you've ever read any books by people that are non-speaking autism that have grown up to be adults that can type and write books, it really starts the same way. They say, you know, I didn't know I had a body. I couldn't feel my body. I couldn't control my body, but I knew everything, right? So if we always approach it, the child knows everything, but they can't show us. They can't point in a reliable way because they don't have that control, and they can't speak. So, you know, if we can eventually get them or give them some ways of communicating, whether it's through technology or whether it's through just a simple letterboard, which is what I prefer, because I don't like them they get addicted to technology so easily, and it drives their left brain. So we have ways where we work with them on teaching them how to communicate in simple ways, yes and no. And then eventually with a letterboard where they literally type it out on a QWERTY like keyboard. The goal with that is that if they can get enough control, they may be able to type, so that even if they don't end up eventually speaking, they have a way of communicating in their devices now that if they can type, it can speak for them. So I think giving them ways of communicating while trying to allow them to speak in their own way, I think are both good technologies. And we've found is that if we give them the bridge to speak, while trying to get them to physically be able to speak, it lowers their stress response and may actually facilitate their language better, because now they have even more of a drive to communicate, and they will engage more in what we're doing. And also there's just a better understanding between everybody, the therapist, the parents, and the child.
Yes. My next question is, so the technology is bad for the verbal kids, not to give them at all, or just to give them in a small amount because that calms them down, or not?
Well, I would say a small amount. I would argue it doesn't necessarily calm them down. It might temporarily seem like it's calming them down, but actually it's driving their left brain, which is going to make them more hyperactive and make them tick more and stim more. And anything that drives the left brain is not good in general. And so, you know, we live in a world with technology, so to completely eliminate it is virtually impossible. Although we sometimes have parents go through different technology detox periods where they usually see huge differences in their kids in a matter of 2 weeks. But, you know, the idea is to limit it. Again, I understand that if parents need a break or they need to try to be able to manage their children, you know, they need to do it in a way that, you know, allows them to live a comfortable life. But, you know, my attitude is, you know, we work with the core issue and we want to eliminate the core problem. And when we do that, we're usually pretty successful at it. So, but in the interim, you know, we try to get parents to really limit the technology significantly and let the child do more play, more, you know, outdoors type of play or physical types of movements, riding a bike, you know, doing different types of art. reading. I mean, even reading, which is more of a left brain thing, we get some of these kids that love to read and they're really good at it, although they may struggle with reading comprehension because that's more of a right brain thing. So, you know, I mean, we definitely want to try to limit technology, but again, we realize that people have to do what they have to do so that they can have, you know, a relatively calm household.
So what's the how old is your youngest patient, and how old is your oldest patient? Because we usually lose time by searching the best method to approach to our children and to find a way for them to be able to communicate, to be able to live by themselves alone, to work, to feel confident. So what is the age of your youngest patient, and is it too old, is it too late for parents to, is there any age that you can say now it's late for you to come, but we can try to do something, or there is no age limit?
There is no age limit. It really, we have patients that are 3 months old. We have patients that are 73-year-old. We work with a wide range of pretty severe neurological types of issues. You know, we do work with some genetic disorders. We work with dementia. We work with Parkinson's. All of it falls into the realm of functional neuroscience, right? Which is my area of expertise. But by far, 50% or more of what we work with are people with non-speaking autism, right? That's what I really do my research in. And right now, I'd say the oldest, let's say, individual with autism that we're working with now is in their upper 20s. And we have, you know, children that are 2 years of age, 3 years of age, that we're working with. You know, the one limitation, and what I built in this facility here was most of the kids we work with, and often many of the older young adult kids with autism, they still have what's called a fear paralysis reflex. There's a new name for this now. It's called pathological demand avoidance in autism. And what it means is that if you place a demand on them, it might trigger what I believe is the fear paralysis reflex, and they might get incredibly aggressive and violent because this reflex tells them literally that their life is in danger. It's the oldest reflex, and it's associated with the freeze response that we see in animals, and in humans we have that too. But what we see is that when this is triggered, again, you know, if you felt like your life was in danger and someone was trying to grab you and examine you and get you to do these acts, you would kick and scream and bite and do whatever it took, right? So this is often triggered. And since most people don't understand this or know this, what happens is many therapists, you know, will refuse to work with kids like this and won't do anything. I had one mom that was here from Sweden, I think, and she said that, you know, for 9 months, she has had a therapist come into the house and sit in front of the child while the child just cries and screams the whole time. And she does nothing. She just sits there because she says, until she stops crying, I can't work with them, right? And so now 9 months has gone by and they've done nothing.
Yeah.
Our goal is to get rid of that reflex, and we have designed a method here to be able to do that. I wanted to design a method that could work with any child or any patient. Even we have kids that are 20 years old and big and 200 pounds, and they may get very violent and aggressive, but we can work with them. And often within a day or two, we can lower that response and lower their aggression. And that's life-changing. I mean, if that's all we do, we have one guy that was here, he's 23 years old. He was about 230 pounds and 6 feet. And he would just beat the heck out of his parents every single day. I mean, literally pull their hair, slap them. And so we brought him in here and we started working with him, and he started doing that with me and my staff. And we were able to, you know, work around it and hold him and, you know, hold his hand so he couldn't hit us. And in the interim, we're treating him, we're working with him, we're doing the things that we do. We're working with his reflexes. You know, we're using different types of tools like lasers and transcranial electrical devices. And we're able to get it on him. And within 2 days, he was a different person. By the time he left, you know, they had not been able to leave the house for 10 years because the last time they did, they went to a grocery store and he was attacking the people in the grocery store, pulling women by the hair and throwing everything. When they took him to dinner the last time, he attacked the waiter. And so, you know, they had virtually not left the house. In the first few days they were here, they started to going to lunch with him and he was fine. And then in the second week, they took him to a mall and he had lunch for an hour and then walked around the mall for 2.5 hours and had no violence, no aggression, and was fine. And since that, he went home and he's been really much better, so that they were going to, you know, institutionalize him because he was starting to attack his 8-year-old brother, and it was dangerous. I mean, he was big and he would get really violent and aggressive. And so, you know, now at least he's able to stay at home and they're able to work with him. And, you know, and we're working on things. His speech is actually coming out more. So even in, like, that's one of the most difficult scenarios. We can work with it. We've devised a method. That's the Melillo method. We can work with anything. It doesn't make a difference how severe it is. We can work with it. And we have a system that is reproducible, that gets reproducible results. And I believe the best results in the world.
Your team consists of what sort of experts?
You know, we have different therapists. We have occupational therapists. We have chiropractors. We have, you know, I am trained in neuropsychology and neuroscience and cognitive neuroscience and functional neurology. And so we have, you know, other people that are really highly trained also, like I am, in functional medicine, you know, neuroimmunology. So, you know, our team is made up of a lot of therapists that I've also trained, people that have come in that have different backgrounds, you know, speech therapy or physician's assistants or different types of training that we bring them in here and we train them, you know, in my method.
So tell me, when parents bring a child to your center, do only children get included, or you also include? I know, but I want other parents to hear. Do you also include parents in your method, in your program? And how do you connect with parents? And how do you help parents connect with children?
Well, we work with adults and we work with children, but the parents are also part of our treatment team. So when they come in here, we don't bring their child in behind closed doors. They come in and we very actively train parents how to do the Melillo method at home. And that's critical, right? Because especially if they live in different parts of the world, they need to go back and be able to do this on a repetitive basis. And they need to do it right. If they don't do it exactly right, they're not going to get the same results. So we do work virtually and we get great results virtually, but obviously we get the best results in person when we can actually work with the child and we can actually work with the parents and train the parents. And again, they become part of our treatment team. As we're working with the child, the parent is either holding their child or working with us, or we're showing them how to do the therapies that we do, and they're doing it and we're doing it. So they become part of our team. So when they go back, they feel like they're really fully trained to go back and bring back what we do. And then, you know, but it's a progressive program. So they come back here, you know, every 3 months or every 6 months, and we'll update the program and give them more training So, as the child progresses, we can make sure that they are moving forward, in the best way.
So tell me, please, how many you have center in America? So are there any centers in Europe?
I do have one center in Bulgaria. It was an original prototype of the Melillo Center that I have here in New York, and we do plan on bringing these out and have other doctors around the world be able to reproduce what we do here. We're building really the ultimate prototype here in New York, but that's a while off yet. The one in Bulgaria is good, but it's an older prototype. They don't do exactly what we do here, but they do an older version of the Melillo method. And so that was, my earliest prototype. And they're really good people there. And so there is that one center there in Sofia. But again, our goal and the dream is to have multiple centers around the world doing this. And that, that's what we're working towards.
So please tell me, I want to encourage our parents. Do you have any special example of your patient that came in need for help, and you made that patient blossom?
Sure. I mean, that's virtually every patient that we work with, to be honest, and I'm not exaggerating, but it's to varying degrees, we have, I had one child that I can think of that came when she was 3. She was a twin, completely nonverbal and very violent and aggressive. And for a 3-year-old girl, I mean, she had that fear paralysis reflex. And by the time she was 4, I mean, you wouldn't even know she was autistic. I mean, she was speaking in a normal level. Her behavior was great. She still had a little bit of socialization issues, but she is doing fantastic. And so a number of our patients that are like that over the course of 1 year may go from being non-speaking to being fully speaking. What we usually see is variations of that, where, even, we have, if people go on my Instagram, they see a lot of examples of these. So at Dr. Robert Melillo on Instagram, I am always putting up videos and messages I get from parents that we work with around the world. And these are real videos and real messages from parents. And it's, it varies from a child being able to ride a scooter and never has been able to do it before, from children that, are all of a sudden starting to speak at different levels, or, are just connecting with their body at a higher level. And now they actually feel hunger and thirst, that, better eye contact, become much more attached to the parents and their siblings, and are interested in other children. So it's a process, that goes along. And, we have so many different success stories. It's hard to pick out one, because many of them are
never too late, and it's never too old for a child.
Never too late, never too early.
Yes, because yes, never too early. But usually with our experts, we deal with the situation. If you had came while your child was 2, 3, or 4, it would be better now. But you came when your child is 12, 13, 14. It's too late now. Is it too late?
No, because remember, there is no genetic mutation. There is no damage to the brain. There's nothing broken. As long as we can get the child and the parents to do things, we can change the brain at any age. So, there's never too late. And that's why when people come in our door, the first sign you see in my office is a sign that says, "Hope lives here." We are always trying to give people hope, but real hope. Again, I'm a researcher, and we've come out with, I think, 5 papers just in the last 6 months in some of the top journals in the world. We just completed a randomized double-blind control study over the past 4 years, looking at primitive reflexes in autism and looking at brain imaging before and after, as well as neuropsychological tests. And we're showing, documenting, huge changes in the brain and in things like heart rate variability, which have a lot to do with things like digestion and the immune system and other things that plague people with autism, not just, social issues or stims or tics, but physical issues as well. Mm-hmm. So we're documenting this, and we have at least 4 or 5 more papers that are going to be coming out by the end of this year on the original data of this showing these changes. So these are real changes that we've been able to prove and that we're looking to perfect and get better all the time.
Food and nutrition. How important is that in your method, and how important is that for children on the spectrum?
It's important. It's very important, but it's secondary. So, no child is going to, the solution to autism is not diet and nutrition. It's also not the cause. Mm-hmm. The biomedical issues that we see that kids with autism struggle with, like leaky gut, inflammation, eczema, food sensitivities, detoxification problems, problems with digestive enzymes, acid, malabsorption. We wrote a paper in 2009 that showed that all of the biomedical issues could be explained by an imbalance between the parasympathetic and sympathetic nervous system, which is obviously regulated again by the brain and brain development. Mm-hmm. And as I said, we're just finishing a study and going to be publishing a paper showing that we can change that balance of parasympathetic and sympathetic, but that increased sympathetic fight or flight tone is what we see in all kids with autism. And because of that, they all have leaky gut, they have poor digestion, they have malabsorption, they have increased inflammation in their body, they have more sensitivity, their immune system is hyperactive because their left brain is hyperactive. So all of the things that we see biomedically are secondary to what's happening in the brain. And they're important. Obviously, if we can reduce inflammation, if we can eliminate foods, if we can supplement them and give them vitamins that they can't absorb on their own, all of that is important. If we can help their body to detoxify as we're trying to get their brain to grow, all of that is important. And we do all of it as needed. I created my own vitamins that I think are very important to right brain or left brain development and for the gut that are very successful. But that alone is not the solution. I see people every day from all over the world that have gone to some of the top biomedical specialists in the world. And more often they come back and they don't really see many changes. And if they do, most of it is temporary or minimal. But when we address the core issue, most of those things go away. Most of the food sensitivities go away. Most of their inflammation goes away. And, because we're dealing with the core issue.
Does it help with a special sort of eating? Pardon my English. Many children have problem with eating some.
Right.
Yes.
Certain foods.
So, yes, some foods. So I'm sorry. It's almost very late at night.
You're doing great.
And I was all day mom today, and with treatments and everything, so my brain works a little slowly tonight. So they have some problems with food, some sort of food.
Yes.
Does your program help them deal with that and finally start eating all of needed foods for their development?
In most cases, yes. Now, what we see is, again, the question is why? Why are they sensitive to certain foods? And that really comes down to they have an imbalance in their immune system. They have a problem with their digestive system. All of it goes back to the brain, right, and brain development. But what we see is that some children will get severe inflammation like eczema all over their body. and especially dairy is the most common trigger for that. If anybody ever has eczema, the first thing we do is get rid of dairy, because that is almost always the trigger. Gluten can be in other foods, but dairy is by far the most common. And sometimes even if the mother is just eating dairy while she's breastfeeding, that can trigger it. But that's because their immune system is overactive. And so there are clearly kids that have some pretty severe food sensitivities, and eliminating those foods can help. But, you know, what we're trying to do is grow the brain. So if we have kids, like we had a kid today who, you know, he's not hungry. He doesn't feel hunger. And so he would literally go days without eating. And if we eliminated the foods that he does eat, he literally wouldn't eat. So that's counterproductive to us growing his brain. So elimination diets are not often the first thing I do. The first thing I want to do is change their brain, and that starts with getting rid of the primitive reflexes, which are always there. But doing an elimination diet is usually something down the road that we will look to. And we have found that in many cases, if not most cases, if we get their brain to work significantly better, that the food sensitivities go away. Okay. Mm-hmm. I'm sorry, I'm going to have to go because I have a patient, and I'm sorry to end this because this is great. You're doing a great job.
Thank you so much. It was very, very powerful, and I see the reaction of parents. They are all happy because they got the information. I'm grateful for your time. Thank you very much, and hope to see you one more time when you are able to. So thank you very, very much for this opportunity.
Thank you. I appreciate it. And again, parents, you know, disconnected kids, I'm coming out with a new edition next year with a lot of new information. We also may make some new information available on our website soon in the form of an ebook that parents can get. But if they go to my website, drrobertmelillo.com, there's a lot of information and a lot of my research papers. Mm-hmm. And also, you know, again, Instagram is something where I'm very big. And if they go to @drrobertmelillo, they can get a lot of information. Okay?
Please, just for parents, do you have YouTube channel or anywhere else they can see some of your videos?
Yeah, actually, my wife and I did a web series, and it is now available on a streaming network called My Home TV. And we have a channel on that. It's not YouTube channel, it's a new streaming network, and it's 2 seasons, and it's called Disconnected Kids, Reconnected Families, and it already has over 600,000 views in less than 2 months. It's the most popular show on this network. And again, if you go to my website or my Instagram, it says, you know, Dr. Rob TV. They can click on that and you can see, you know, where on your home TV, the link that they can go to so they can watch these shows. I think they'll find it very educational.
Thank you one more time for your time and for this genius information, and hope the parents will be able to contact you and get more information they're interested in. Thank you one more time.
Oh, it's my pleasure. Thank you for having me.
Thank you. Good night.
Okay. Good night.